It's part of our viewer question this morning. It's got a lot of people talking mask wearing. Let's talk about that. And limited gatherings could soon very well be a thing of the past. The health department is now waiting for feedback from provincial health authorities on whether the COVID-19 regulations that are left should be scrapped completely. The department has proposed to the National Coronavirus Command Council, the NCCC, that all remaining regulations be cancelled. Good idea? Bad idea? Let's speak to Professor Benjamin Smart from UJ's African Centre for Epistemology and Philosophy of Science. Prof, always good to have you on eNCA. So there's three main issues we'd like to get through. Of course, we know they're talking about mask wearing, gatherings and entry limitations into South Africa. Mask wearing, though, I think is the one that most people want to know about. Where do you stand on this?
Well, I think abandoning the mask wearing regulations would be in line with the data we're currently receiving. It's not clear to what extent the masks are effective in the first instance, so there is that to consider, particularly given that most South Africans are wearing ordinary cloth masks and often multiple use without washing. So there is an effectiveness issue to consider as well. But obviously, you know, the main issue with mask wearing is that it's inconvenient and unpleasant, and people are tired of wearing masks. And if they were making a big difference, and if you know the rate of daily new infections was very high, then mask wearing would make sense if they were effective. But you know, right now the fifth wave has come to an end. It never really peaked at a massively high level, at least not in comparison to previous waves. And so ending the mask regulation does seem like a sensible move by government, in my opinion.
And let's talk about the gatherings for a moment, because there's still quite a lot of confusion. It seems that you can go into a casino, you can go into a church, full capacity, but you can't go into outdoor sporting stadiums, which is out in the open with 100% capacity. So this is also a bit of a thorn in the side of the health department. What is your understanding behind the logic on that of mass gatherings? And do you think it's time to get back to normal, if I can use that term?
Look, I mean, throughout the pandemic, looking for a logical explanation for the government regulations has sometimes been somewhat tricky. And I think this is one case of that. You've got inconsistencies in the regulations. It does, or it certainly did, make sense to keep gatherings under control. But, you know, what you find when you look in the stadiums is that everyone's packed close together. So a stadium might be half full, but everyone's in the same area of the stadium. And that doesn't make sense anyway. So I think, you know, you've got to look at it in broader terms. You've got to look at the social and economic consequences of these remaining lockdown regulations. And I think, given where we are in the epidemic curve, it does make sense to start easing these off.
So the health minister phones you after our interview this morning, Prof, and says, OK, Prof Ben, what should I do? Drop the masks, let people into stadiums? What would you tell him?
I'd say drop the masks and let people into stadiums.
And when it comes to the international travel as well, that's a slightly more complicated issue, because we don't get to make that decision on our own. That's a lot more based on the numbers here, because other countries will decide how and when they want their visitors and residents to come into our country. How would you handle that situation?
I think the tourist industry is extremely important to South Africa, and we need to be proactive in negotiating with you know, our counterparts in foreign countries. For 2.5 years now, the tourism industry has suffered horrendously because of lockdown restrictions, some of which were perfectly justified and necessary and understandable. But now we're at the stage where we've got 50% of the population vaccinated, and many more than that have prior infections. You know, most people have prior infection. There is a level of immunity here, and that's also the case all over the world. So I think that you know, these restrictions should be lifted, and I think that sensible negotiation with our politicians, foreign counterparts, should be productive.
And hopefully that is what happens. Professor Benjamin Smart, always good to have you with us from the University of Johannesburg.